I'd like to welcome you very much for joining us in this session. I'm Ilona Kickbusch. I'm one of the co-chairs of the Global Health T7 Task Force. And with me is Anna-Katharina Hornidge, who is the other co-chair, and Adam Kamradt-Scott, who is supporting us in this process. I'd like to say straight away that as we started this work, and I'm not sure if he has been able to join us, we invited a third co-chair, Dr. Githinji Gitahi from Kenya, from AMREF, because we felt it's very important in global health to have a voice from the Global South advising us. And while we have this consultation with you, I want you to also know that we will have a consultation organized by our co-chair with colleagues from the Global South. This is absolutely essential as we discuss global health and move forward. You will probably have seen that a number of prestigious and important colleagues have written policy briefs. We are just in the process of finalizing those policy briefs. They will be consecutively also made public, and that is something we're engaging in now. And of course, each of these policy briefs has their own set of recommendations, not all of which will make it into the final document, which we issue as the chairs as what is called an issue brief. We want your advice on this issue brief. I will just give a few points of where we are heading with our recommendations, obviously keeping in mind that there are priorities also in global health that have been set by the G7 presidency, and to some extent we also reflect those. You will see that one of the key factors we want to highlight in our issue brief is particularly the role of the G7. We do have in the G7 practically all the major donor countries together, and many of the issues around financing global health, around financing global public goods, about how we manage overseas development assistance, etc., has actually been decided, shaped, whatever verb you want to use, by the role and this group of countries, not within their meetings of G7 to some extent sometimes, but over the last 20, 25 years. We feel very strongly that as this group of donors, and actually the German Chancellor just indicated that in his speech also, the G7 have a special responsibility, and we see that responsibility related to equity, and we see it related to a long-term strategy on global public goods and on planetary health. So it is living the responsibility of the G7 countries, their commitment to multilateralism, and we also felt their commitment to democracy, this being particularly important at this point in time. So obviously the issues that we are taking up relate, I've already indicated, to financing and global public goods. It is related to the global health architecture, where we argue strongly against an increasing fragmentation of the global health architecture and a support to the World Health Organization. We argue very strongly for the follow-through of the recommendations and decisions already made in the G7 in relation to pandemic response. These are both structural and financial, but have not really been followed through. And related to that is particularly the global public goods surveillance, the sharing of information, the transparency of the whole system, and similar access. We have tried to structure our recommendations along sort of three lines. I mentioned the follow through. of the short term, these are promises you made. This is what you have to fulfill now. This also relates to short-term financing like Act A, that many of you will be familiar with. Germany has fulfilled that commitment, but other G7 countries have not. We then have a grouping around the medium term, which in some cases also relates to given promises. You don't build up a surveillance system overnight, obviously, but we're looking also to the Japanese G7 presidency with the strong focus on health systems and UHC. And we feel strongly that this infrastructure development, and the German government has asked for proposals for infrastructure development, that we see building a resilient health system as a determined infrastructure development. And then we say, of course, we need to change the way we think about global health, how we think about financing global health. Again, I've already mentioned the global public goods approach, but this also relates in many ways to the interface between the environment and health. Also relates to some of the other task forces that are taking this up as well, and that we particularly, and you will see there is also one a policy brief on this, that we see an understanding and a commitment and an action to planetary health. My very last point at this point is, before I hand over to my co-chair, is that we want to make clear we are not out of the pandemic, and it will take quite a while until we're out of a crisis environment. The next crises will also be heavily related to health. There's a public health crisis brewing in Ukraine. There is health crises related to refugees. There is the hunger crisis that is coming our way, the increase in poverty because of the cutting of global supply chains, etc., etc. And so we also want the G7 to have a different mind frame as an organization, to not work from one G7 to the next G7, where each one sets their own priorities and tries to create a new institution, task force, or I don't know what, but that we are suggesting what right now we have called a G7 Global Health Compact, where they agree on the priorities they want to resolve jointly over the next 3 to 5 years, and which they will also take into the G20. This is trying to summarize what we're trying to put together. Obviously, please, Anna-Katharina, pick up from here. We formulated 4 questions for you that Anna-Katharina will present, and then we will shut up and hear from you.
Thank you, Ilona, and hello, everybody. It's very good to either see you here in person or in the virtual world, so to say. Well, the 4 questions that we had formulated are, on the one side, which are the 3 to 4 priorities that we would want the G7 to advance in. Now, Ilona just mentioned the 6 basically lines that we see emerge from the policy briefs as 6 main sort of lines around which we can string also the narrative. Then we will ask, or we are asking, what kind of multilateralism do we envisage in the field of global health? Third, how to assure continuity over several presidencies of the G7. And of course, then the question of what role does the G7 play in the G20, and how does the Ukrainian situation make us reflect newly or rethink also the role of the G7. We've been in our discussions on how to frame the narrative in the issue paper in a way that we capture the current situation, and the current situation is, as we observe it, very much shaped, or the attention by the policymakers within the G7 is very much shaped by the situation in the Ukraine. So we would take that up and pick up on the UNDP human security report that basically speaks of a people-centered security perspective and brings together here different forms of insecurities, of which violence, hunger, and health are three main ones, as well as, of course, then the fourth field of planetary health. Ilona already walked us through the 6 lines, sort of sorted into what has to be done now in order to also fulfill the Carbis Bay decisions and recommendations. Then move into so mainly here, the overcoming of the pandemic, just to reiterate. Then move into the midterm, which is the whole field of strengthening health governance, while of course the strengthening of WHO falls under the short term. Then the investments into pharmaceutical science and the further development of production capacities on all continents. We've seen some progress here, but that is still insufficient if we also look at the situation in the African context. Then we have also midterm the investments into surveillance systems and systems of health preparedness. Of course, the whole challenge of international financing, the beyond aid discussion you mentioned already. And then with regard to long-term, the perspective of restructuring basically the institutional infrastructures within the field of health and also climate as well as biodiversity around the concept of planetary health. So these are sort of the 6 lines, and now over to all of you actually in order to discuss them with you. I see many of the authors of the different policy briefs. So please also remind us of aspects that these 6 lines do not capture, but of which you are saying that should definitely be in. And I see Mylene. Yeah, yes, please.
Hi, everyone. This is Maylin Fang, Chair of the People-Centered Internet. I think what I am not seeing perhaps as strongly is the impact of digital and the use of digital tools and digital building blocks and how we achieve this. I think thinking about infrastructure without taking into account the changes that digital enables us, not only in science, but actually the common participation of local people in their own community to build their own resilient communities and to let us know how to help them in ways that are appropriate and that serve their own needs, gives a far more sustainable long-term global health picture rather than us sitting here in Berlin trying to work it out for everyone. Yeah, but it's just easier because you're here. Okay. Oh, so the final thing is, so the ITU, the UN are working on digital building blocks for health, and it should be incorporated in all the planning.
No, we fully agree, and we see it under the line of basically investments into pharmaceutical science, into the investment into further building the production capacities, as well as also into the logistics of reaching the last mile, so to say. No?
So I want to qualify, because there is a change. You're thinking about reaching the last mile as though they're the recipients. But what we're saying is with digital building blocks, they can actually help to innovate.
Now, who else would like to come in? Also from the virtual space, colleagues, please be invited to come in with your remarks, concerns. Ich kann das So I see one hand up, but I can't see the name. Please just come.
Okay.
Sorry.
No problem. My name is Uwe Schneider. I'm living in Köln in Germany. I'm heading consulting for global and One Health approaches. So what I'm missing a little bit is at least the focus on the One Health approach, because we see the necessary currently also on the crisis in Ukraine and what is happening also on food supply and so on. So to have that in the policy paper would be an advice from my side. And also, as Chancellor Scholz talked about how to linkage at least the political sector with the private sector. What I'm missing is a little bit the cross-sector collaboration emphasis for integrated capacity building for a pandemic crisis or for the universal health coverage infrastructure. And so maybe that could be something that we can put also in the policy paper of this T20 year. Thank you.
Yeah, thanks, Mr. Schneider. The One Health approach we basically brought in the planetary health approach. I fully realize that it's not the same. There's a vast discussion going on, and nevertheless, we have basically a whole policy brief around the planetary health idea, and I think the overlaps of both concepts are quite substantial. So that's where I would basically see this being represented. The second aspect, yeah, private sector, it's so far under financing for us, no? But I realize it could be probably woven into a number of the 6 lines. Yeah. Thanks.
Can I say something, please?
Yeah, please come in.
Yes, so I participated at the UN Political Virtual Academy last year.
And maybe you could just briefly say your name, because we can't read it.
I'm Paula Rem from the University of Vienna. So last year I participated at this UN conference, a virtual conference, and we were talking about necessity of creating a universal healthcare as an answer to the COVID pandemic situation, and also to prevent migrant crisis, for example, because some countries maybe people from some countries would move to other countries for healthcare, because healthcare is better in some countries than others. So we were talking that universal healthcare should be established throughout the world to eliminate health inequality. And the UN argued that their problem is they don't have any mechanisms to actually implement this. They can issue recommendations for states, but they don't have any mechanism to make states actually implement this. So I was wondering if you have some ideas which mechanisms should pragmatically be implemented in order to make states actually comply with these measures which we are talking about. Thank you.
Well, we actually have one policy brief on that, and maybe Rob Yates, who also wrote that policy brief, might want to speak on that. I mean, the WHO always refers, mechanisms have been established to a large extent, how you build a health system, how you finance a health system. But you're quite right, none of the UN organizations can force a country to invest in their health system. One of the things that we wanted to draw attention to, and that's why I refer to the Japanese presidency next year, is that Japan actually, in its last presidency, took the initiative to bring for the very first time health and finance ministers together for exactly that reason, to also take that forward. And this was in the context of the G20. And this time around, the UHC discussion at the UN is due to take place in 2023 during the Japanese presidency. And they want to use their G7 presidency now to push for particularly a financing agenda around universal health coverage, because the issue has been that the while now there is a better understanding of the needed investment in pandemic infrastructures, public health surveillance, etc., this has to some extent pushed UHC agenda a little bit to the side, whereas the need to build what is now called resilient health systems is absolutely critical. So I think if the largest donor countries commit to such an agenda, that might help us take a step forward. But we will look carefully at the recommendations based on your comments. Thank you very much. And I don't know if Rob wants to come in here. This is your bread and butter, Rob.
Thanks very much indeed, Ilona. Yes, I'd love to talk about sort of financing universal health coverage. And I think it's absolutely crucial that the G7 realizes its responsibilities and its limitations really in how one goes about that. And you've already referred to the importance of the G7 fulfilling its commitments to multilateral financing mechanisms, and you know, a lot of announcements made in Cornwall last year that haven't been met. And you know, we really must hold the G7 to account on that as an absolute bare minimum. Otherwise, we're just not serious about trying to prevent future pandemics. But on the other hand, I don't think the G7 should have sort of delusions of grandeur about how it could, and even if it's appropriate, to finance UHC reforms across the world. You know, because at the end of the day, we've all seen that the most important thing for that is domestic public financing. You know, it is the only way to reach universal health coverage. You know, using general taxation or social health insurance or some form of socialized health financing system. But I do think that the G7 could have a very big role in encouraging, inspiring, facilitating governments to be able to do that themselves. And you know, that will be around, you know, maybe the way that the multilateral financing instruments work. Think about special drawing rights, thinking about tackling tax havens, increasing corporate taxation rates, the whole issues around sort of global financing that could potentially free up resources for countries to really step up their financing of their own health systems. And this is perfectly feasible. If you look what China did after SARS, when it tripled the share of GDP it spent on health, in the order of $500 billion a year in tax financing into its health system. Countries can do this. And I think that maybe with us sort of often sort of thinking of a stampede to sort of create giant funds that are going to strengthen health systems across the world, we're perhaps maybe sort of taking the pressure off ministries of finance that, you know, now is the time that they might take those big steps to socialize their health financing system. And you think about these big middle income countries now, India, Pakistan, Bangladesh, Nigeria, Kenya, that really you feel are at the stage now that they can take that step up in domestic public financing, and that the G7, having made those transitions before, maybe with the exception of the United States, can facilitate those processes. Thank you.
Thank you very much, Rob. And actually, just for those listening, some of those suggestions were made earlier today by Gitahi from New Delhi, who was actually listing very similar points that you had just put forward. And we will also be looking again at the recommendations of the WHO Council on the Economics for Health for All, which also includes some of these financial options. And as you rightly say, health systems can't be financed by donor money. That's negligible, and the WHO work has shown that very clearly, that it's a tiny, tiny percentage. So that's why the Director General of WHO says health is a political choice, and one has to make those choices. Any other comments from the room? No? From there? Adam?
I guess I'd probably just ask us to, if there's further sort of comments or suggestions around some of the questions that we're posing, in particular with regards to the importance of multilateralism and particularly how the G7 can further strengthen that within global health in particular, and if there's some practical suggestions that folks have that they would like to sort of see the co-chairs consider in their final report, that would be helpful. So we've listed a number of the sort of top 3-4 priorities. So we've kind of addressed that with digital, looking at things like universal health cover, focusing on One Health, but yeah, just in terms then of sort of some other sort of steps for improving multilateralism would be appreciated. Thanks.
We produced a policy brief on digital economics to actually increase the digital literacy of policymakers and, in fact, traditional economists about using digital footprints. And that could actually help with multilateralism, because if people are starting to measure things and they can see it real time, it came up, Dennis Snower talked about, I think various people talked about it, that we can have real time indicators. And if people are more clear about what's going on and the benefit of investing in this sector in actual public health as opposed to just clinical health. So the American model has really put a lot of money into clinical health, but the social determinants of health account for 85% of the health outcomes. And that recognition has been very hard for the public sector to take on, partly because they don't have the indicators and measurements. So earlier on, Rob Yates was talking about China. Singapore also doubled its health budget, and it was because of public health modeling. And these digital economics, public health modeling can make it really clear to policymakers, invest today, a stitch in time saves 9.
I agree fully with you. I'm just asking the group that is here, what do we recommend to the G7? You know, what is the specificity of writing a policy brief for the G7? I would agree fully with you, you know, in terms of advising policymakers all around the world to do X, Y, Z in the G20 and wherever and at WHO. But what is it we want to impinge on the G7, more or less some of the richest countries of the world with, you know, an enormous influence. There have been, you know, calls to decolonize global health, to, you know, have other voices there. So how do we balance the responsibility of the G7 and what we expect of them politically, so that we don't say, you know, we want you to say what the direction of global health is, but we want you to fulfill your responsibilities that you have. And it's that balance that we really want to find. Like, you know, the Germans do say, we think the G7 has a responsibility to strengthen the World Health Organization. That's a very straightforward statement. And so this has also been a little bit speaking to policy brief authors here, our problem with some of the policy briefs, because, you know, their recommendations have been correct. I mean, you know what I want to say with correct, but they, you know, it's really, you know, what do you want the G7 to drive and take forward? I think there's a hand up there, 2 hands up there. I think if you can help us with that, that would be very kind. Thank you.
Maybe I can come in on this. I have 2 points that I wanted to make. One is that now in the pandemic, it's very clear to many experts that global health policy can make a very real difference. So it seems to me that it would be a very good opportunity to also point out in the issue paper for the policymakers that there is a very real opportunity for the G7 to come in and to commit funding for projects in global health that are successful. So that might be very good to provide some evidence where global health institutions or the emerging architecture, as far as that has already been built, has actually made a real difference. and coming, therefore, I think it would be also very helpful to sort of prioritize proposals that can help resolve the pandemic, because there it will become very clear to the policymakers that we can make a difference. And some of these proposals, like my own, that is concerned with these vaccine patent buyouts, I would like to point out that there are complementarities that can be exploited. When this becomes a reality, it will of course make a huge difference to the pandemic, but it will also strengthen multilateralism, like the COVAX institution, make a huge change to architecture, maybe become a role model, and then maybe mobilize more funding from the G7 as we move forward into other issues, pressing issues in global health that could benefit from recognizing these enormous gains that can be obtained in the course of managing the pandemic. Thank you.
Thank you. I think that's Thomas there who wants to speak. Is that correct, Thomas?
Yeah, if I may, thank you. So this follows immediately on what Michael just said. I think that if the pandemic has shown anything, it has shown that we need a global strategy, that we need to include poor people in any effort to improve global health, because first of all, with the pandemic, obviously, poor people have remained a breeding ground, both for the disease and also for new disease variants. And the same is true more broadly for other infectious diseases such as malaria and tuberculosis and so on. So we owe it to the poor to include them in a strategy, and we also owe it to ourselves in a way to have a globally successful strategy to include them. And here the biggest problem seems to be the monopoly rent system, the monopoly patent system that we now have, that blows a heavy headwind into the faces of the poor in two ways. One is that existing drugs become unaffordable to many people, and the other is that diseases concentrated among the poor are not lucrative areas of pharmaceutical research. And so what we would be proposing is that the G7 spend a little money on piloting an idea that would give innovators the option to be paid in terms of impact rewards if they are willing to give up their monopoly privileges on a particular product. So that could be tried out, and then if it works well, it could be scaled up into a permanent institution. Thank you.
Thank you, Thomas. And for those who are not, well, no, we haven't posted the policy briefs on the web yet. I was going to say read Thomas's policy brief for more details, but we're just in the process of doing that one after the other. So I apologize, but you will be able to read more about it. Can we have perhaps some other suggestions for the questions that we have posed? You know, what do you consider the priorities for the G7, and maybe also some of that link up between the G7 and the G20, which also links to this discussion, and in what way the G7 should perhaps, and here I take Thomas's point about the dialogue with the poorer people and poorer countries, how to organize that. I do know that some of the recommendations for the Japanese G7 are in such a partnership mode, that they want to reach out in new ways, and that's not dissimilar to what the German Chancellor just said. We want to, in a new way, help not, the traditional overseas development aid. We're thinking supply chains, production centers, etc., etc. He's still somewhat restrained around a TRIPS waiver, as you might have heard, but that doesn't need to constrain us. That in terms of our recommendations. So if we could hear some more from the people that we sort of see from afar on the screen, that would be fantastic. Hang on. Okay, thank you.
Thank you, Paul McCallister from the United States with Global Leaders in Unity and Involvement. I have a basic question, and I think I heard the co-chair mention something about violence in the context of health. And so my question would be, do any of the policy briefs this year or in the past, have they correlated health to violence? And if so, what metrics have been used, or what are we open to proposing, are listening to, or receiving additional information about that, and asking the G7 to respond to violence as a means of addressing health concerns, particularly amongst the poor in the global South?
Well, we were discussing how to pick up on the Ukraine situation in a way that basically shapes the overall narrative, the framing of our issue brief, and at the same time gives us the space to end up with our sort of recommendations. And here we felt it makes a lot of sense to basically use the people-centered human security concept that is put forth by UNDP since a number of years, and underline that, of course, the Ukrainian situation is a situation of violence, which is a health risk, of hunger, which is another health risk, and then move towards the overall topic of global health governance through the reflection of the Ukrainian situation out of what that means for the multilateral system perspective. Yeah, so if we further shape a multilateral system that makes it possible that a large neighbor can ignore and disrespect the sovereignty of a small neighbor, if that is the way the world is going, then that will lead substantially to further increases of health risks, no? And in order, so that would be sort of the framing. Are there further points?
Yes, perhaps I could ask another question related to that. I mean, my name is Michael Strauber from the Kiel Institute for the World Economy. I apologize for not introducing myself earlier. But when we talk about the war of Russia against Ukraine, I mean, there will be huge health implications. There is likely to be an acceleration of the spread of various infectious diseases in Ukraine and maybe neighboring countries that will threaten us here in Europe especially. But I would also like to point out, I mean, I condemn the war of Russia against Ukraine very much, but should we be silent about various wars that the United States have fought, such as Iraq and other undeclared wars using aerial drones to attack people in various countries in the name of the global battle against terrorism? Is that something that should be completely ignored? And then we highlight the current war, which is, of course, a major crime against the people in Ukraine, and it's a war crime, what's going on right now. But if we talk about the context of global health, it might be worth thinking about the health implications of the war that was fought against Iraq, and also these the more global war against terrorism. Thank you.
Yeah, I mean, we will not be silent about the other wars. We will also mention those. I mean, I think the core message, or the sort of front line, is global health is global politics, and vice versa. Having said this, we also have to see that the geopolitical consequences of the ongoing situation are going to reshape the world order. That is not belittling other wars at all, but we need to acknowledge that severity as well, and find ways of acknowledging that probably already Syria was definitely also the crossing of the red line was there, no? And Afghanistan again. And we have to now see that basically the shifting of the world order is in progress. Maybe the West is waking up a little late, but that does not mean that we can continue ignoring these wars, no? And at the same time, you know, it's also about striking the right balance. Our issue paper should still be about global health and global health governance and concrete policy instruments. We must not now completely divert from that focus towards focusing on basically the war and defense policy making, etc. So that's sort of the balance to strike. Ilona, come in, please.
Well, there is, of course, the general question about how health security is defined and how health responsibilities are assigned and how they are sanctioned in quotes within the UN system. And of course, you know, everyone that talks about the Security Council and Russia now at least should remember Colin Powell a couple of years ago in the Security Council as well, where, for example, Germany did not vote with the United States, which was quite a scandal at the time. So I think what we are trying to express is that, you know, this war raises a number of questions, you know, just thinking of Srebrenica, Aleppo, or Mariupol now, it's been a general disregard to some extent of the brutality. The health system of the health organizations, of course, thinking both of WHO, but also the ICRC, etc., have drawn our attention. And this is one point we are raising that, you know, as the rules of war and the rules of multilateralism are no longer accepted, that the attack on civilians in these wars, the attack on health systems, even, you know, in fighting Ebola, people have been killed, so that you know, these very basics for which the international community set themselves rules of protecting civilians, of protecting health professionals, of protecting healthcare infrastructures, are increasingly by many different parties being not upheld. And I think this is a very, very serious matter, which, you know, relates to what you said and what's happening in different parts. We, of course, know that this is both raised at the Human Rights Council, but also to some extent, sometimes at the WHO. But these are definitely issues where I would say that the Ukraine war should perhaps help us, but at least in this part of the world, to open our eyes much more than we have in the past. And the G7 should take a responsibility here. Maybe there's a chance to talk about that under the present US administration. We don't quite know what's going to happen there as we look forward. We definitely know what we couldn't talk about when the Trump administration was in power. But I thank you for your comments, just because it reinforces what we were grappling with: how political should our policy brief be? And, you know, and that's where we're trying to find a way.
And we have to slowly come to an end again. So I would like to look around the room again. Is there another hand up? Sorry, I can't quite see it. Is there?
Yes.
Yeah, please.
Yeah,
Okay.
I'm Aiden Hollis from Canada, the University of Calgary. I just wanted to emphasize, following our experience with COVID, the importance of the private sector in bringing products to market and the the terrible conflict which we've faced over the last few years, in which there's been this urgent need to get more vaccines to people, but the private sector has had kind of different views on essentially investment and pricing. And it's clear that we do need, if we're thinking about the kind of the medium term, if we're looking to have consistency across several presidencies and accountability, we need to have consistent, essentially proposals coming from the G7. And that means that at least we have to have proposals that are going to make sense of the role of the private sector in bringing new health products to market. So I'm thinking that that means that, for example, policies which are going to be sort of veering from removing intellectual property to, you know, again, implementing it are not policies which can be sustained. And so we need basically incremental fixes that are going to support the existing systems, but also essentially make the existing systems of intellectual property actually acceptable in the world, which is, I guess, part of the point that Thomas was making earlier regarding the Health Impact Fund. So I basically wanted to say we do need to have better policies to integrate the private sector, given the existing conflicts around intellectual property.
I have a specific private sector recommendation. So the G7 had agreed to the 15% minimum tax for the digital companies. Why not the G7 take some of that and say, address it to the global health problem? And for example, Microsoft already has a vaccine equity consortium that they've convinced Amazon to join. So the tech giants are moving in that direction. Why not just ride that wave and say, people are all concerned about how do you collect that digital tax? Well, give them a good reason to give the money, which is to address global health, which they need addressed anyway.
Well, they are addressing it. It's one of the largest businesses they have. So I think, but it goes back to your point, you know, how do we bring that together and what are the new rules of the game? And I think we don't have rules of the game because most of our global health rules were established before the health industry became so large and so important. And, you know, it's a very diverse industry, and also before the tech industry moved into health. So this is definitely something that needs to be looked at, and slowly the European Union is looking at, but we're definitely not far advanced, but it's a very good thing. Of course, you know, if we think about financing, Rob gave a couple of examples. There was, you know, also the, in one of the examples is Brazil, that actually used financial transaction tax to build its health system, but couldn't keep it up politically. But definitely it made a tremendous difference to be able to invest in their, I forget the exact title, family health system. And that was quite crucial. So, you know, there are mechanisms that that go deeper, and we probably need to look at them in more depth. I don't know how much time we have left. We're out of time, I'm told. So the question in the chat was? Not yet, which whereby I come back to the point, you know, our problem in global health is how big global health is. And we already have 12 to 15 policy briefs full of recommendations. So, but we will look carefully, because definitely mental health, as we all know, has been an valued part of global health, where many actors are saying, particularly following the COVID crisis, which we are still in the middle of, I might add, that mental health issues have really come to the fore in a quite extraordinary way. And thank you to the person in the chat to drawing our attention to it. We are going through all the recommendations in the policy briefs right now, trying to group them, trying to look at patterns, trying to look at which we pull over into the policy brief, into the issue brief, I apologize, and how we set priorities there, and what we might have to add. You know, we could have had so many more policy briefs. I was thinking when our colleague here was talking about violence, that of course, you know, one could have had a big paper on women's issues in global health. You know, one could have had so many different policy briefs. These were the ones that emerged. These are the ones we're working with. And I think one of the things we will have to do in the issue brief is to say, you know, this is something that we feel important to take forward now, but it definitely doesn't have any feeling of, you know, that all important issues are there. I think we need to find the right expression of that. So let me thank you very, very much for your time. Let me also say particularly to colleagues who've written policy briefs and have listened in but not spoken, feel free to write us an email of any suggestions or concerns you might have while we are working on this issue brief, and then we can take the discussions forward. Anna-Katharina.
Yeah, also from my side, I would like to thank all of you in the room, as well as all of you joining virtually, and all authors contributing to the different policy briefs. All of you have received some feedback. Some of you have already resubmitted. Thank you for doing that. We will then, as soon as they are resubmitted, basically the publication process starts. So we very much appreciate if also those who have not yet resent their papers, please do so. And yeah, thank you for joining today again. And we're looking forward to continue the discussion in the coming weeks. Thanks.